the substantive part of today is comes from a suggestion that was made by one of our colleagues that given the environment that we're living in, the changing nature of where we are, and the impacts that we know it's having on a lot of companies that are trying to operate or have been told they can't operate, that it might be worth having a panel discussion based around business practices and financial strategies during and after COVID-19. So I've asked, together with Dirk Keenan, 3 members of our club to give us their perspectives on this situation, and from there, a discussion among the panelists, should they wish, and I know they would certainly be welcome to any questions or comments you may have from the floor as well. So with that, Dirk, I'm going to ask you if you'd kick off, please.
Thank you, Pardeep. It's great to be here again and to see all your smiling faces. We know that COVID's had a big impact on business, and potentially my thought was that I would love to hear what other business people are in our Rotary Club are doing, and I thought that this would be something worth sharing. So in the next 5 or 6 minutes, I'll tell you what I'm doing, and then I'm going to be writing down what Nigel and Gay have done in their businesses, because that's truly my biggest interest. So I'm going to talk a little bit about my clinic, and then I'm going to talk about the sort of steps I've taken to sort of mitigate the crisis. So I'm just going to read from my notes that I made, and happy to answer any questions in a couple of minutes. So, my clinic is best described as a consortium of independent contractors who lease space and personnel and equipment from me on a monthly basis. The clinic could be described as similar to a school of fish that work together for efficiency and protection and respond to the marketplace by constantly changing and adapting. Now, in March 16th, I made the decision based on the events taking place in Ottawa and around the world that we had to close the entire operation. And then the next decision I had to make was how we were going to survive, given that we had no money coming in, and at the time our overhead was, verging on 60 to 70%. So the strategy I started was to take an online course to help me understand what were the key things that I needed to do to survive a financial crisis in business. And it turns out that the most important thing that any business needs to do during a financial crisis is preserve cash flow. So we had, in order to survive in a period of no income, find ways to delay, postpone expenses and to identify opportunities for creating income. So the first expense we needed to cut, because it was about $150,000 a year, was our payroll, and that included human resources and benefits and so forth. So we had to lay everybody off. Fortunately, we had EI available for everyone who was laid off, so that was good. We kept one person on part-time for about 15 hours a week, and that was something we really had to do because we had no business coming in. We also took myself and my wife off our benefits plan. We kept our benefits for all our employees, and we still have it, but we took ourselves off the benefits program, so we didn't have to pay for that. And we made some changes to our benefits program because dentistry and paramedical was no longer available, so we were able to get some deductions for that. And then I want to shout out to the accountants of the world. They were very helpful in helping us find money through the government programs, including the RBC $40,000 loan, and also postponing different payments was helpful. So the accountant was definitely someone that I got in touch with, and he was very well informed about all the different government programs available. The next thing we did was we started contacting our clients who had balances with us. So our accounts receivable was potentially a place where we could create an income. So we contacted them personally by telephone, and many of them were happy to give us the money that they owed, and that was an important step to take because, you know, obviously there was no way to generate income. I also approached all of my suppliers and creditors and asked them for better terms, delay on payment dates to help improve cash flow. Amex actually, Platinum Amex reached out to all their clients and offered them 90 days of no payment without any interest. So that was nice. And I noticed many of the banks are doing some things to reduce costs, including reducing service charges. The next thing was to review all our statements, our bank statements and our credit card statements to cut out anything that wasn't very, very important. So we did that. And we started making those changes to make sure we weren't incurring any expenses that weren't absolutely necessary. And the final thing that we did, which has been helpful, is we found that my wife is a naturopathic doctor, and she was able to perform naturopathic medicine on the phone or online, similar to what we're doing here today. And she was able to maintain at least half of her clinical hours. And then it became clear that we were allowed to operate on emergency basis for emergency cases. So even today, I'll be seeing half a dozen or so emergency patients in a new environment where we're only seeing one patient at a time, and we're all gloved up and have masks, and we practice many hygienic protocols to make sure that we don't cause any problems for them with respect to the infection getting out. But and we screen our patients to make sure they don't have any of the symptoms before they come in, and we have hand sanitizer by the door. So we're being very careful to take care of our emergency patients, and that's also been helpful. So that's, in a nutshell, you know, some of the things we had to do. I would say, if you asked me how much of a revenue drop we've had, we'd say about an 85%, 88% revenue drop. So obviously that's a lot, and it's you know, it's something that all small businesses have to deal with, and we've seen small business come up with new ways to generate at least some income. And you know, certainly healthcare is no different. We also have to figure things out. So that's it for me, Pardeep. I appreciate the opportunity. I'm really looking forward to hearing how Gay and Nigel are changing their business. Thank you.
Thank you, Dirk. Nigel, maybe I could move to you next, if you would.
Yes, certainly. Good afternoon all. We're a little plastic foam manufacturer in Stittsville. Our production went down about 50%, 55% with the start of the outbreak. We were deemed essential, first by New York State, of all places, and then by a few of the government departments and some businesses that have long-standing contracts, mainly with D&D. We spoke to all the staff and said, guys and gals, you can stay home and get $2,000 a month, you can stay working. And a few decided to go home, so that was fine. About 3 or 4 weeks later, they wanted to come back because they were earning far more money with us than they were sitting at home. Our first concern was the safety of our staff and ourselves. First thing we did, we stopped the cleaners coming and cleaning our facility, and my wife and I have taken on that responsibility. But we just saw that as such a potential danger, with cleaners going to many different offices. Some of our contracts were postponed, some were canceled. We met with all the staff that was still with us, and we spoke about cleaning protocols and workplace distancing. These protocols have reduced our production hours by a couple of hours per day per production employee. We have 3 engineer designers. We sent those, they started working from home. They lost about 30–40% of their daily output, partly because they were using VPNs to send files back to production, and partly just working at home. It wasn't working for them, and now they were back working in the design office. We no longer let couriers come to pick up from our door. It is now locked. They must come to our office, and then we get staff to carry stuff out to their vehicles so they don't come in the building. You know, one of the pities of doing that is many of the couriers would come to us and use our facilities because we were considered a friendly place. Well, now we've said no. So I don't know what the poor buggers are doing. But I just think that's I know it's a silly thing, but it's just something that one should sometimes think about. When we get a delivery, and we get a few deliveries a day, we quarantine everything for 48 hours, which sometimes means that we're now delivering some products late, which goes completely against the way I built the business. We're having an extension built on the back of our building, having about 3,000 square feet put on, 20 feet high. And the architects came to me a month or so ago and said, "Do you want to postpone it?" Because most of their work is being postponed. And I thought about it and I decided, no, we'll go ahead and build it. We're probably now not going to need it for a year or so. But I just felt that we should, if we have the ability, we should put money in the economy. I think that's what's got to happen. The only thing that's holding us back now is getting some of the permits. That sort of has come to pretty much standstill with the city. I don't think Canadians should rely on the government to bring back the economy. I think we've all got a part to play with this. I'll spend a few minutes talking about post-COVID. I'd like to start with a few stats. I got some stats from C.D. Howe Institute, the Fraser Institute, and Forbes. And I first got Canada's debt to GDP is about 34%. And the US to GDP is only 17%. But before you think we're doing a lousy job, I also looked after a country called England. And their ratio to GDP is 87%. Much of Europe falls in around that, which is very, very dangerous. These figures are for 2019. Our unemployment figure is 13%. Some statisticians would say it's more like 27 to 30. The US, it's 14.7. So they're a bit higher than us, if I take the 13%. For the US, it represents 23.1 million people. I couldn't find UK figures for 2019. I got 18, but 18 would be nothing. So I don't have those. You know, I think most of us are expecting our taxes to go up just to be able to pay for all the monies that are being given out. And Bill Morneau, you know, our finance minister, he co-authored a paper while he was with the C.D. Howe Institute. He basically stated that if taxes go above 50% for any Canadian, and I think the top rate is now 52.7 or 54.7, that the rich people find ways of not paying the taxes. And the article stated that when this happened in other countries, total money collected through higher taxes actually went down. Although Mr. Morneau is now singing a different tune these days, I guess when you become a politician, things change. By the way, rich people were defined as those having over $100 million in assets. For what it's worth, I like stats, so I go a bit crazy at times, so I'm just going to give you a few. In Canada, we have 44 billionaires. England has 45, France 39. The US has 618. The US is only 8.9 times larger than us by way of population. I thought they were always 10 or more, but those are the facts I got. I read another interesting fact that said 3/4 of all diseases originally came from animals. And I'm probably, this is probably more gays bellywork than mine. But it's interesting. I've been following that a bit and wondering whether as time goes by, whether we think how we eat and how we get our meat. Air travel, sea cruises, sports venues, they're all going to suffer greatly. Like for universities, will lose much of their foreign student body. This thing about local restaurants, you know, doing the pickups, I don't think local restaurants can stay above the profit line if they've got to lose 30 to 50% of their seating capacity. I believe, you know, the country could end up at some point printing money, which I just think devalues our currency. We are an importing company, especially since we lost the auto pack. Prices for goods we purchase, like most of my products, come out of the States. So, they go up. So then, I've got to pay more, the currency goes down. It's a vicious circle, but I think we should soberly think about it before we start putting our taxes up. Within my business, on May 19th, we will be bringing all staff back to work full-time and on full wages. We're now back probably 65 to 70% of our regular business. We will focus on keeping our prices the same as what they are now. This is knowing that we will not have the same amount of hours to produce product every day. We're just going to have to figure out other ways. Again, I just think if you put the prices up, volume goes down. It never goes to the bottom line. It gets swallowed up. We're going to be challenged making a profit, a year-end profit, but that's the way it is. I'm always saddened when companies go out of business, even if some of them are my competitors. Small business owners, entrepreneurs, they put their hearts and soul into their businesses. They deserve to stay in business. Mary and I, we pick up dinner at least once a week from one of the local Italian restaurants in Bell's Corners. We usually never eat out that much. We probably don't eat out more than once a quarter. But we're doing it every week because we just think we should do our part. I certainly believe, that all Canadians should buy locally. Buy flowers from the local florist. Buy whatever you can that's Canadian. The dollars have got to turn. If the dollars turn, we will come through this quite nicely. But every one of us, whatever, if it's $1, $5, $100, $1,000, let's get the dollars turning. I've got a few notes here on the economies of the world, and then I'm finished. The US has 23.6% of the world economy. China has 15.9. Japan has 5.7. Germany is 4.6. England used to be 5th. It's now been replaced by India. What did you say, Party? You didn't, okay. With at 3.9%. The UK is now at 3.3. Then there's France, Italy, Brazil, and it used to be Russia was number 10. That's been replaced by Canada. We are now the number 10 official ranked economy in the world, and that's at 0.09%. But I think it bodes well for Canada. And basically, that's the end of my presentation. That's how we're surviving and hope to continue surviving. Gay, take it away.
Thank you for that, Nigel. Just before you start, Gay, colleagues, if I could ask when you're speaking, just to check to make sure you're actually in frame so that we can see you as you speak. Thank you. Gay.
Thank you, Pardeep, and hello, fellow Rotarians. It's a pleasure to speak to you about my company called GEM Healthcare Services. I founded it 26 years ago, and it was 26 years in March. We have 3 pillars of business, which is government homemaking, where I supply homemakers to look after people of the Social Services Department of the City of Ottawa. I have institutional relief staffing with long-term care facilities. St. Patrick's Home, really close to where we meet, is one of my homes. And I have family retained services, which people actually pay money to. And I have a little niche business called mask fit testing. My ratios break down to about 35% both for government homemaking and institutions, 20% for family retained, and about 10% for mask fit testing. And I'm very involved with my Home Care Ontario Association. I'm vice president of the board, so I'm very tuned into what's happening at Queen's Park. I'm on conference calls every day, and sometimes 2-3 times a day now. But I got wind, and I knew we needed to get repaired. So I've broken my presentation down into sort of highlights per week of what we did. So back in February the 28th, it was a payday for me. I decided to do a safety blitz for all my employees. So I brought them in to pick up paychecks and give them mask fit test them, give them safety kits with gloves, gowns, masks, hand sanitizer, anything I could give them, and instructions on what to do. We also taught them on how to do the screener, the COVID screener. It was a paper presentation that came through from from Home Care Ontario and the government. We then, the following week, started to work with my software company that we use to help us do care management and scheduling. It's called AlayaCare. It's a Canadian software company, and I spoke to them and I said, I want that screener on my employee's smartphone. They're going into people's homes. I want them to be able to screen right at the door. I was the first person of their 250 clients to ask them that question, and we did it. And so they're now using it as one of their signature platforms for helping people. I also said we needed to track all of our cancellations either by employees or by clients so that we would have records, and thank heavens I did that. On the 23rd of April, we were declared an essential service by the Government of Ontario, and I knew that we had to ramp up and keep people ramped up. And about that same time, all of my long-term care facilities asked me to dedicate employees to them. So my employees couldn't go from one place to another, and which was fine with me. We did that, and we were able to dedicate staff to them. I just don't have enough staff, but we're certainly able to do that. And of course, we dedicated our employees to our private clients and our City of Ottawa clients. They're okay with our employees going from one place to another because they see that they're well protected with masks and gloves. So we ended up doing that. I used to have a paper time card that people would sign for that, and I eliminated that on the 20th of March, along with when we went essential service, and we used this AlayaCare system. It has a GPS locating thing so my employees can lock in and lock out. We had an uptake when we first went to that of about 20%. Now we have an uptake of about 95%. Because when you have to tell the boss what your time is in and time out is, you do it. We have an ability to do the clocking in through on the smartphone with people who have data, and even people without data. They can call into a robocall phone number and clock in and clock out. So it's been an amazing adventure for us. And I also had a system where I did half direct deposit and half not direct deposit of paychecks. We used to like people coming in to pick up paychecks. I eliminated that, and we went 100% to direct pay deposits using TD Bank is the bank I use, and then also using our QuickBooks system to help it. And that we had a few little growing pains at the beginning, but I remember emailing all of the employees that didn't get their paycheck on the day and saying, "It's coming. I promise you'll have it instead of Friday. You'll have it Monday," and it did. I went to skeleton staff on the 29th of March in my office. I come in every day just to keep the ship going, and I have two coordinators working from 7 in the morning until 3, and then 3 and there's an overlap 11 o'clock till 7, and that works quite well. Everybody else I send home, and they're all working from home. We've put a screening table right at the front with a big red stop sign with hand sanitizer, and we screen. We do temperature screenings of anybody who dares come into the office. We have caution tape in front of all of our offices to say don't come any further, and we're keeping that social distance. I wrote up my first email to my employees to encourage them called Gem Strong, and I wrote that out and sent it in an email blast that week, and we also posted it on our Facebook page. We knew we needed more staff, so we ramped up our Indeed ad and started doing Zoom interviews with various people who were wanting to come and work for us. We signed on with on April the 6th, we signed on with our AlayaCare system to do a virtual visit model that they designed, so my supervisors can still do virtual visits with clients in the community that we're still being asked to serve, and that's working quite well. We had our first Zoom orientation session with those new employees, those 5 new employees we hired back in April. And PPE was becoming a problem. I was running out of supplies. We realized that the government, even though they said at times they would help us, weren't going to help us. So I started searching madly for PPE across the country. We went to our Hazmaster supply person. They sent us some K95 masks, which are the ones that are approved in China. They actually don't pass our mask fit test, so we only use them as procedure masks. We found procedure masks looking like this from some of our suppliers, and that's the one that we give our homemakers. I knew I wanted a screen, so I've now got a face screen that goes over like this, so between that and the procedure mask, they can use those. I had a desperate search for hand sanitizer, and I found out through my nephew, Rob Butler, his friends were all volunteering to help a distillery company called North of Seven do hand sanitizer, putting them into bottles. I sent a $500 donation, and I said I need 150 of these for my employees, and sure enough, 150 arrived at my doorstep on Easter Monday. And so I've distributed those to my employees. I'm running out. I'm going to send them another $500 donation and get them to come in. Get those back in. The face shields come from Winnipeg. Denzel, you'll like to hear that. And gloves have been coming in, small sizes, large sizes, but now we've got a full complement. So I sent out also another email called Gem Heroes, just saying encourage them to keep working. I had a number of people start to tell me that they couldn't work when daycares closed and schools closed. They had to stay home. So we understood that. I looked into the benefits that exist for that line of credit for $40,000 to help me with cash flow, but because my payroll's over 1.5 million, I couldn't qualify. We have looked into the wage subsidy program, so we are applying for that, and we're going to qualify for that. We have a handful, about 10 to 12 employees on CERB right now. I couldn't get the rent subsidy because, again, we're an essential service and we're working. I hired the services April the 13th. I hired the services of a mental health counselor to help my employees, all 100% confidential. So she's doing mental health counseling via an internet connection. She goes to my church. She has a master's degree in counseling and is working on a PhD in forensic psychiatry. So she's very qualified. So I'm using her, and she's getting more each week. She's getting more and more appointments. So I'm very, very happy about that. April the 20th, I'm still sourcing more PPE, and then the government announced that the $4 pandemic pay was for essential workers, but they had originally said it was only for people who had government contracts. So I didn't fit into some of those categories. So again, through my association, we've been doing a lot of political advocacy, and we've been persuading them, and they've been changing their minds as we move through, because basically a frontline caregiver is a frontline caregiver and is right there up close and personal with a family member or a patient with, they run the risk of getting COVID, so they should be paid that. It's effective April 24th. We're actually going to do that. I've got only a couple seconds to go. Veterans Affairs asked me if I would do virtual visits, and of course I can, because I've got that capability with my software. We had our second Zoom orientation the 29th of April. We've hired 4 new people. I got a new contract with the Youth Services Bureau and the Youth Justice Program for one of my nurses. St. Patrick's Home caused us a bit of a hiccup. They tested on the 1st of May. They had two residents test positive, and I had to send 6 of my employees off to be tested, but they all came back negative. So I then pumped up more PPE for them, including one of my nurses who goes there full on PPE. His family was nervous, so I've put him up in a downtown hotel. So he's staying at a hotel, so he doesn't go home, and he's got some peace of mind with his family. then I sent the final, last week, I sent out the good news email saying that we had a full supply of PPE to give everybody, and that the raise was coming, so that's happening for their next pay. We ended up getting a lot of uptake on our mask fit testing. The Ottawa Hospital hired us to send a team out for 2 weeks, 7 days a week, to help them mask fit test their employees. This is for the N95, the medical mask. And now dental practices are calling us because they've been told by their dental society that they can't do procedures that involve water unless they are N95 mask fit tests. So we've got 2 mask fit testers in my office testing all day long. We're getting dental calls from all kinds of dental practices. So you'd like that one, Cletus, I'm sure. And just this week, my sneeze shield has arrived. I'd ordered it up, and it's now at my front desk, and people are happy about that. And people are coming in to pick up more of their safety kits. So I have this all written out. I can send it to whoever's doing spin-off, since I know what spin-off writing is like. So if you tell me who it is, or I'll ask Dawn, I can forward it to them. So that's what we're doing, and we just, you have no idea the number of requests that I'm getting from other long-term care facilities, which I just can't fill, and we can only do what we can do. Thank you.
Thank you so much, Kay. Just to answer that last question, Graham is doing spin-off this week.
Okay.
But I think we've heard 3 very interesting perspectives and very interesting ways of proceeding forward during this period. I'm hoping that our 3 colleagues be willing to entertain questions. So I will open the floor for questions. And what I would ask is that when you pose your question or your comment, that you let us know whether it's to any one of the speakers in particular or to all of them. So floor is open. Andrew.
Okay, can you hear me now?
Yep, I have Andrew, then Dave.
Okay, these 3 stories are absolutely fantastic. Thank you.
Thank you, Andrew. I have Dave, then Ken.
Okay, if you need any help with the wage subsidy criteria or application, we got our first direct deposit on Monday for the period from March 15th to April 10th. And
Okay.
the second window from like April 12th to May 9th opens on midweek this week for the application. There's some tools in terms of calculator, but there's also criteria in terms of eligibility. But if anyone needs any help with it, certainly feel free to give me a call. We have 45 employees that we submitted the wage subsidy for that are still working with us with the online business, our office, and our bike repair, bike sales component of the business. So it's a program that's certainly going to help help bridge some of the sales and profitability loss.
Yeah, thank you, Dave. Yeah, my accounting firm is helping me through that too. My biggest issue is some of my people, I think, went on CERB, and so we have to make sure, you know, CERB and the wage subsidy, we can't do both. But I don't know.
No, if you rehire them and pay them retroactively to be able to apply for the wage subsidy, those employees will have to be aware that they may have to repay some CERB money.
Yeah, that's what I thought. But okay, thank you.
Thank you, Dave. I have Ken next.
Mostly directed towards Dirk and the kind of services that he offers. I mean, many of us are able to visit, our chiropractors, physiotherapists, dentists, and optometrists because we have coverage on our insurance. So I was wondering, Dirk, if you've heard anything back from the insurance companies, because all of us are paying monthly payments to these insurance companies. They know they don't have to pay anything back because we can't access these services. Even when the services open up, they're going to be so jammed, you aren't going to be able to get in for another 3 or 4 months. So it means that they continue to take our money without having to pay anything. Now, I did track down the personal email of the president and CEO of Manulife, which he was trying to keep hidden. But anyhow, and I sent him an email on this to try to find out. And I haven't had an answer back other than they issued a claim number, but because we can apply for some of these services and get reimbursed, that's how we can visit some of these people. But they're taking the money and there's no services being offered. Have you heard anything, Dirk?
I can speak to that. I know Sun Life offered employers who were providing extended health benefits a 10% break on their premiums because of the lack of availability of paramedical services. So in our clinic, we have physiotherapy, chiropractic, massage therapy, naturopathic medicine, and right now we're only able to offer chiropractic and naturopathic medicine. And you're right, the other services are not available until this is over. But from what I understand, there has been some adjustment made in the premiums by Sun Life, and I imagine potentially other insurance companies may follow suit.
And they're giving that premium back to the employer, but not the individuals with individual coverage.
That's true, yeah.
Other questions or comments? Merv.
Well, I'd like to compliment, can you hear me?
Yep.
I'd like to compliment all the speakers. I think they're on the front lines, and as Jen said, they're real heroes. I would be interested to know from each of them if having an immediate COVID tester, in other words, one that you could do yourself and it was reliable, if that would facilitate your business activities.
Oh, I can respond to that. If I was able to do that when people were coming into my office, even for mask fit testing, I'd test people and I would ask employees who are nervous at all or out there if they were working and they wanted to get tested too, I'd certainly use it. Yeah, for sure.
I'll just say that we do screen people like Gay does. If they have any symptoms at all, we won't see them.
No.
And we do PPE as well. I'm not sure that there's enough test kits to go around, but I do believe that if everyone was tested, we could potentially contact all their contacts and have a big impact. So the availability of testing would be a tremendous benefit to society for sure.
Nigel, I don't know if you want to comment.
Yeah, if we had the opportunity, we would use it all the time. Wonderful idea.
Okay, thank you. I have Denzel, I believe, and then Andrew.
Yes, I think I'm unmuted. Did you hear that?
Yes.
Asante has about 800 advisors across the country, and we were really recently asked to give about 3 hours of counseling a week for any kind of financial that I can help with. So you yourselves or friends or family or anybody you think, if they'd like half an hour to an hour or two, if necessary, to give them whatever tips we can on finances, loans, taxes, banking, and all that stuff. Asante people are available for that, and I am for sure. That's me.
Thank you, Denzel. Andrew, then I think Keith Henry.
Yeah, can you hear me?
Yep.
Yeah, I think there's a firm in Nepean actually that does an instant test, or I think it's a 3-minute test. Basically, you take a swab and you put it in this machine. I don't remember the name of the company, but it's the machines apparently work quite well.
Okay, I don't know if you want to comment on that, if you know about this one.
It may be the one that is from Ottawa here, but they were having trouble with their test swabs, I think, and they had to stop their distribution of their test kits. I think, if that's the one, I'm not 100% sure.
Yes,
Okay.
That's it. Yeah.
Yeah, they've got to replace their test swabs, but they're in the process of
test
doing
swabs. Yeah.
Right.
Yeah, in the process of doing that.
Yes.
Okay. I don't know, Keith, did you want to get in? I thought I saw your hand earlier.
Well, we own a small business with my family, my wife and son and myself. Been in business for 48 years. On March the 18th, we had to close completely and able to open on May the 4th, partially, and today we're still only operating in a small way. I enjoyed the speakers very much. They had lots of time to prepare and just excellent. But I could attest to them. We have a $1 million payroll, and we had to do some juggling pretty fast. That's all I'm going to say right now. Thank you.
Thank you, Keith. Yeah, no, I think we all understand. Ken, did B want to get in, or did you? Hi, B. Ken, you're muted.
B, sorry, could you just do that again? I'm sorry, I didn't unmute you. Go ahead.
I said that I compliment all the three speakers, and I would have hoped that Dr. Dick would be the essential service. And also, I congratulate Gay for a quarter-century business she has run, and also congratulate her for Nursing Week today, which is 200 years old of Florence Nightingale.
Thank you, B. There are other questions or comments? If not, I want to thank on your behalf and my own Gay, Nigel, and Dirk for having given us a really interesting perspective on their businesses, but also how they're coping in these current circumstances. The only comment I would make from something Nigel said was about restaurants. We know a couple of people in the restaurant business, and they're doing takeout more to keep themselves visible than in the anticipation of making money. But we hope some of these will be around afterwards. And Dirk, I really want to thank you for having proposed this discussion. I think it was a really good one. I'm seeing an awful lot of really interesting comments and nodding of heads around the thing. So thank you, Dirk, so much. And I think what is shown is we can have some very interesting presentations, very interesting discussions in this environment. And so if you've got suggestions for topics, please let Gay know, let me know. Bill.
Yes, I would propose that we have this discussion presentation again in 6 weeks, because things are moving rather rapidly all around us, and we're not idle. At least some of us are not idle. And it would be great to have an update to keep us going, because that's very encouraging.
Would our three presenters be willing to come back in about 6 weeks and tell us where things are?
Sure.
Yes.
Yes.
Okay.
Sure.
Thank you. So thanks for the suggestion, Bill. So we'll come back, we'll put it on the agenda in about 6 weeks and see where things are, how things might have changed, hopefully for the positive, and go from there. But if there are other suggestions people have for this type of discussion, I think we'd be very open to try and organize something. So thank you again, Dirk, Gay, Nigel, for having done this for us and let us know where things are. And I echo the comments I'm seeing on the chat line of wonderful work. Thank you so much.